wanted to talk about the topic of risk management. So I wanted to just discuss what is it, what is the process, and what are generally the outcomes of a risk assessment, which are what we undertake when we feel that someone is at risk. A risk assessment is usually completed when we feel like a patient or client is at risk of self-harm, suicide, homicide, violence towards others. If it's a child, whether they're being neglected at home or in some way, or also exploited, so this can be financial, sexual, any other nature, and often the financial comes into play, especially with people with disabilities or the elderly. Risk assessment is all about risk management. So this means that while we can never totally eliminate risk, we want to do an assessment to find out about a person and manage the risk or make the risk more manageable than it currently might be. One way we do this is by doing a clinical assessment of the person, a physical assessment, psychological, sociological, so what is their home life, what is their environment like, and also spiritual. So are there any spiritual resources or beliefs that might be affecting this person? We want to make sure that we do this in a collaborative way that is non-judgmental, and also I often like to bring in multiple professionals if it's in a particular setting to make sure that the risk assessment is involving more than just me and that we're really able to problem solve and plan. In my risk assessments, I like to also work on identifying what are the triggers and situations that maybe have led to this psychological crisis for a person. Ultimately, in a risk assessment, our goal is, like I say, to manage risk. So then, as a team or with the patient or individual, I often come up with a care plan or a safety plan. This can either be a contract that we both sign or that we kind of include different things that we will try and do and work on to minimize the risk of this person harming themselves. So that's pretty simple. That's the process of a risk assessment for me. You can use different tools as well to kind of assess where the person's scoring for anxiety, depression, and other psychiatric symptoms if you are qualified or a mental health professional. If someone's doing a risk assessment with you and you feel that it's not collaborative, just remind them of that piece. And that a risk assessment is supposed to be holistic and really approach the person as the entire person that they are, so their life, their interests, and what has led them to this place where they feel where they are a risk to themselves or others. Thanks so much for watching, you guys. I will see you next week. And don't forget to check out my resources below and my website for free ebooks. Thank you.